Okay, Wasim's coming on. Okay, I think we have everybody. We're ready to start. Good afternoon, everyone. Welcome to our first annual general meeting on Zoom. We're also with a live feed via YouTube. For those watching at home, my name is Dan Wilson and I'm the current board chair. All of the AGM participants today have already received a copy of the agenda and all the related materials. So with that, I will now officially convene the 26th annual general meeting of Windsor Regional Hospital. To begin, I need someone to make a motion to approve the minutes from our June 20th, 2019 annual general meeting. And that's Lynn, seconded by Anthony. Are there any comments or questions or revisions? Seeing none, all those in favor, please signify by raising your hand or thumbs up. Okay, that motion is carried. Thank you. We begin our proceedings today by receiving a series of reports, the first of which is from our President and CEO, Mr. David Mouche. So I will turn it over to you, David.
Thank you, Dan. Just want to make sure I'm not on mute. Not on mute. Great. All right. Thank you, Mr. Chair. To say this was a unique and unprecedented year is an understatement of our lifetime. I won't repeat our presentation from the June board meeting and our highlights, but I'm going to focus on two major accomplishments this year. Accreditation with exemplary status, a status that is limited to a select few in the country, and a surplus year-end operating position, a long and challenging road to get through these troubling times. Both are directly related and both dovetail. They identify the strength of our team, including our frontline employees, professional staff, management, volunteers, and the board of directors. I want to take this AGM to thank our current board chair, Dan Wilson, whose term is ending in the next few minutes. Over the past 2 years, and this past year in particular, I've spent more time with Dan than my own family, and I bet he will say the same. He's definitely part of my COVID-19 social circle. What people sometimes do not appreciate is the board members are volunteers and their time is unpaid. They might get a rubber chicken dinner once a month, but the time they spend at board meetings, committee meetings, various calls is priceless and shows their dedication to our community and our team members. As chair, Dan spent that time and more. We had to work very closely with the ministry all year to address issues that needed to be addressed that arose since the realignment. In addition, Dan was involved in professional staff legislative privilege hearings and chief of staff selection process, to name a couple more larger activities that are all volunteer. Dan has always added a very valued insight and direction. There's never been a decision of any substance made by WRH that did not involve Dan as chair, and for that matter, the board as a whole. I'm going to miss my calls with Dan and look forward to starting those regularly with Anthony Panicia. Sorry, Anthony, I apologize to your partner in advance. Dan, our hospital and community has benefited from your leadership and guidance. You have left the organization on a great path, and I look forward to working with you as a past chair. To the board as a whole, I've always enjoyed my relationship with the board. Unlike some CEOs, I try to get the board involved in operations in addition to their governance role. Our board has an amazing, varied background that's been commented on by anyone that comes across them, and that adds great value to any issues we face and provides a perspective from a community's lens. As stated, this year has truly been unprecedented, but your clarity, strength, and guidance individually and collectively as a board has been awe-inspiring. To the senior team, we had about 10 seconds to celebrate our accreditation results and financial results, before we move forward with implementing the pandemic plan. Your individual and collective leadership has resulted in these results and our response to COVID-19. In addition, your leadership has resulted in a small amount of positive COVID staff, even though our COVID positive patients is one of the highest in the province. With 9 staff testing positive for COVID in an organization of approximately 5,000 staff, speaks to your leadership and value to ensure our staff and our community is educated, trained, safe, and protected. All of you have worked endless hours and days pre-COVID and during COVID-19. Karen McCullough, you personally got this organization into an amazing position entering this pandemic to ensure we had capacity to address any surge. Your passion is actually infectious. Dr. Saad, so how do you like your first year as Chief of Staff? Easy, right? It's been a breeze. I love Gary Yang and I love Dr. Saad. I could have not had 2 better Chiefs of Staff to work with this past year. I would go into any war with Dr. Saad without hesitation. Mark Fathers, your environmental teams have ensured our environment is clean and avoided any internal spread of the virus, let alone your finance team that is ensuring all our pandemic expenses are tracked. Rosemary Petrakis, ramping down operating rooms and working on the gradual resumption has been stressful and needed a steady hand like yours at the helm. As a result of your work and that of Karen McCullough, I stated earlier, we were able to not stop cancer surgeries during the pandemic like others had to. Monica Staley-Liang, you had a tough little start. You coped through it, you made it through it. Amazing, you're a trooper, and you led the cancer and renal program without a hiccup, ensuring their safety and delivery of services. At the same time, you handled very complicated changes to visitation policies and continue to monitor its implementation. Teresa Morris and Jonathan Foster are new members to the senior team, but are not new to being leaders. Jonathan led the field hospital with Dr. Chevalier at St. Clair in his spare time and was mentioned as a gem by many families I talked to. Teresa expertly addressed and navigated issues in our medicine program that did not stop during the pandemic. And then Mark Ferrari, his insight into primary care in the community and his leadership with Ontario health teams has been invaluable. Did I miss anyone? Oh yeah, Karen Riddell. I'll give everyone a telling story about Karen's dedication. I called Karen the other day at 5 a.m. and asked her, when do you think it'll become improper for me to call you at 5 in the morning? I recall she stated, when I stop answering. She still answers, by the way. Karen has tackled COVID-19 head on. Like she said at the start, we're not preparing for a battle, we're preparing for a war. I would go to any battle and war with Karen and the members of the senior team. Cheryl, I have to say thank you for tolerating me during COVID. I know it's been a struggle, and you are a valued employee for our team and our board. And then Dawn Sutherland, who works with me, has been with me pretty much as long as I've been married. So Dawn and I have worked together in multiple different places, a couple places, and continue to work together. And again, she tolerates me as well. So I greatly appreciate Cheryl and Dawn for their support. When this pandemic started, I challenged our team to be the strength for our community and guide them through the pandemic. They delivered with flying colors. As we've stated, we're far from the end. Actually, we're probably at the end of the beginning. But as stated by Helen Keller, alone we can do so little, together we can do so much. Well, damn it, we've done a lot together, and we'll do a lot more together. The future looks bright for Windsor Regional Hospital and our community. Thank you very much, everybody. That's my report, Mr. Chair.
Thank you very much, David. Great report. And next, we turn it over to Dr. Wasim Saad for the report from the Chief of Staff.
Thank you, Mr. Chair. You know, when I was asked to say something at the annual general meeting, One of the things that you sort of think about and reflect on is the past year and what it's like, and where were you a year ago, where are you now, and where do you see yourself in a year? Let's just look at it this way. A year ago, we had 0 inpatients with COVID, and right now we have 0 inpatients with COVID. So really, not much has changed. But really, the other thing I thought about is who do I thank? Because really, this is not a one-person job. Obviously, a lot of teamwork is involved in trying to create a successful first transition into becoming chief. So I do have to thank Gary for last year around this time when we started to transition the roles over. He was tremendous in giving me some insight into everything that's happened before, what to expect moving forward. And I truly valued that from him. The MAC and the chiefs, as a department chief of medicine, you don't really know what's going on in the other departments and how much work is involved in what they're doing. And then when you become chief of staff, you start to see how much they're doing. These are chiefs that are tireless in their work ethic. They are answering calls and emails at all hours of the day, always advancing their programs forward for the betterment of patient care. Even the rest of our professional staff, especially during COVID, when people needed to step up, they didn't need to be pushed to step up. They came out with flying colors when we needed to staff the assessment center, when we needed to staff the field hospital. Just amazing. Even with our new recruitment and retention committee, the academic research committee, we have great chairs that have stepped up. Caroline Ham for the academic research, Mark Chevalier in particular for recruitment and retention. And as I move forward with the 5-point plan to improve quality in the organization, people are just coming out of everywhere to want to be involved, and they need to be involved. And I couldn't be happier. That culture shift that I was talking about to the board in the fall when I initially gave my presentation about the us versus them and the hospital, and now I feel like there's more of an ownership of it, and everybody's starting to talk about we and us as opposed to them and the divisions. As I move forward with the implementation of the 5-point plan, obviously there's a lot of support that's required, and I do have to give a shout out to to the medical affairs team led by Jessica Bennett, Lori Trotty, Renee Sperduti. I don't think they expected the amount of work that was going to come their way when I took over as chief of staff, but they have again come through wonderfully. We're trying to expand the role of medical affairs and get more people in there to try to help support the vision. But they've done an amazing job so far, and I want to thank them for that, because obviously I couldn't do my job without them. Which then brings me to the executive committee. I remember walking into my first executive committee meeting. I showed up and the comment was, "Oh, what are you doing here?" I said, "Well, it was in my calendar. I was just going to every meeting that was in my calendar." Obviously, they were joking. I think it was a hazing ritual for a new chief of staff to say, "You don't belong here." But they were obviously joking. I've come to work with them very closely, to know them. You want to talk about tireless work ethic. When I'm on call sometimes and I'm walking down the hall at 7 or 8 o'clock at night, these VPs are sometimes still in their office doing work. And they're answering David's calls at 4 and 5 in the morning, and they're here at 6 p.m. So I don't know where they have time for family or the rest of their lives. And of course, the CEO and president, you want to talk about a wartime president? David is a wartime president. Say what you will about how he gets things done. He gets things done, okay? I know he's putting his hands up like this, but, and we said it, halfway through the pandemic, we were on a call together late at night, and I told him, and he said it already, if I ever had to do this again or go to battle again, there's nobody I'd rather go to battle with than David. He has a very clear vision of what needs to be done. If you have something to ask him, he will always give you an opinion. He's spot on for almost all the decisions that he makes. I say almost, you can't be perfect, David. I mean, you're great and everything, but I have to say leadership from the top, and he shows it. And I can tell you, every decision he's made, he's thinking about every single employee in this organization. We try to come up with a plan for something, and he already is thinking, well, what about this person? What about the housekeeper? What about the nurse? What about the doctor? He just has a great vision for everything that's going on. He sees all the moving pieces, and when push came to shove in the time of a pandemic and hard decisions needed to be made fast, he made them. And yes, it was a team effort, but obviously it starts at the top, and I couldn't be prouder to work with somebody like him. And hopefully he'll stay on for a lot longer, and hopefully we won't have to be led through another war. The other people obviously I have to thank is the board. Here's a quick story. Last year, this time, I had just gone through the selection process for chief. I knew I was going to be the incoming chief, and I had booked a vacation, my first vacation in 15 years. I get a call from Dan saying, "Oh, we have our annual general meeting. Why don't you come to the meeting and introduce yourself to everybody?" And I said, "Oh my God, I just booked my vacation. I was going to talk to my wife and cancel it." So I told Dan, he's like, "Don't worry about it. Just come to the September meeting." And all I could think was, oh, great, the board's going to think I'm a slacker, I'm lazy, I won't come to the meeting after being invited. And then I showed up to the September meeting, and every single one of you came up to me, introduced yourselves to me. It made me feel extremely welcome. I specifically recall Paul Lachance coming up to me and speaking to me in French, and we were off to the races since then, which is great. Pam sat beside me, and I don't want to call her a mother figure, but she hugged me and made me feel very welcome. So I just have to say, this group of dedicated volunteers, and David's right, I couldn't believe it at one point where I found out they were volunteers and not being paid. Like they put in a ton of work too. They have to look at the governance and some of the operations, but you have a clear vision. Every time I've come to the board with a request for academic and research, it's been fully supported. I think you get the big broad view of it. You know where you want to lead the organization, and it's been a pleasure working with everyone. In particular, Dan, we had our we started doing our touch bases, because I didn't really know coming into this what a relationship between a chief of staff and a board would look like, and having those meetings every 2 weeks with Dan in between the board and the MAC has been very helpful for me. It's been, he helps me focus on the issues that need to be addressed. And I kept him updated as much as I could. And it's been a great working relationship. And I look forward to the same with Anthony over the next couple of years. So overall, again, it's a team effort. I'm sure there's lots of people I missed thanking, but I do, in this year of reflection with everything that's gone on, those are the people that really affected me during this past year at the hospital. And I look forward to working with everybody again over the next year, so that at the next AGM, I can also report that we have 0 COVID patients. Thanks, Dan.
Okay. Well, thank you both, David and Wasim, for providing your reports. They are both very good reports. I need to say that both of you have provided exceptional leadership this past year to the organization, and in particular, you've demonstrated extraordinary leadership during this time of the COVID-19 pandemic. Next is the chair report. So I will try not to repeat what David and Wasim have said. As David mentioned, it's been a year with a lot of activity, a lot of developments, a lot of advancements, and I'm just going to hit a few of the highlights. As it's been mentioned, a year ago this time, we were saying goodbye to Gary Ying, who was our chief of staff and had served the hospital very well for many years. And then shortly after we said goodbye to Gary, the two chief of staff, Gary and Wasim, made the transition, and that transition was seamless. And Dr. Saad has done an exceptional job of stepping into the leadership role and responsibilities as the new chief of staff. Windsor Regional Hospital was successful. Another highlight is that we finished the fiscal year with a positive financial outcome. And Mr. Michael Lavoie, our treasurer, is going to provided a lot of details at the June 4th board meeting, and he will speak to that when he gives his report in a minute. Windsor Regional Hospital strives to provide outstanding care with no exceptions. And again, referencing the June 4th board meeting, we received an extensive presentation of all the things that have transpired over the last few years. And it's an indication that we've made tremendous strides in improving the quality of our care and also in the flow of our patients through their hospital experience. As David mentioned, we went through the accreditation, and the accreditation resulted in us receiving exemplary status. And the accreditation testing and the results really confirmed what we already knew. And what we already knew was that the processes we have, the policies and the practices are strong and they're responsive and they're effective and they're efficient. And we can be proud of that. As David also mentioned on June 4th, that it's hard to believe just after we did accreditation, we were right into the COVID-19 pandemic. This COVID-19 virus, we all know is dangerous and it's terrible, and it's had a significant impact upon people, individuals, and families in our community and around the world. Yet in the face of that, the entire team at Windsor Regional Hospital has demonstrated leadership, has shown courage, has shown compassion, has collaborated with each other and collaborated with other organizations within our region. And many of the members of the organization have really self-sacrificed to keep people safe. You've provided, the team here has provided the care to the patients and families directly impacted by the virus. And you've worked very hard and advocated very hard and passionately to keep our community and each other healthy and safe. Again, I could go on and on talking about the COVID-19 pandemic and Windsor Regional's response to it, but I won't do that. But the bottom line is that we were tested. We've come through it so far in an amazing fashion, and we're stronger than ever. And the strong processes we have in place, they've kept people safe. They've allowed us to create the necessary capacity. They've resulted in activities happening in a very orderly, a very quickly, efficiently, and collaborative manner. So on behalf of the board of directors and the community at large, we would like to publicly thank the entire Windsor Regional Hospital team for a job well done this past year, and particularly during this pandemic. So thank you, thank you, thank you. And in conclusion, I would like to take a moment and just express my appreciation to all the board members for all their hard work and time and effort this past year. And as mentioned, from my perspective, it's been a very busy and a very full and yet a very rewarding year. I would also like to thank Cheryl Clark for all the support and help that she's given to the board during this past year, and in particular to me as the board chair. Dr. Saad and David, you guys are amazing people, and Karen and the entire executive team, and I could go on, and all my board members. It's been an amazing year, and you're an amazing group of people doing fantastic things. I'll conclude by saying that the annual report, which includes the audited financial statements, that will be posted to the website within the next couple of weeks. And please take the time to read the annual report. It contains lots of good information, particularly some additional highlights that we didn't touch upon tonight. For instance, the new PET scanner, which is very valuable and important to our community. The initiative we have to advance health research in our region and partnerships that we have, and then the various things that Windsor Regional Hospital does in demonstration of compassion for the community. So with that, this concludes the board chair report. I thank you for listening to me. I would now like to introduce and turn the floor over to Mr. Michael Lavoie so that he can deliver his financial report.
Thank you, Mr. Chair, and good afternoon, everyone. Once again, the firm of KPMG conducted an audit of our operations for the fiscal year ended March 31, 2020. The Finance, Audit, and Resources Committee met with the auditors on February the 24th, 2020, to review the scope of their audit and their proposed fees. At this same meeting, we discussed the auditor's areas of risk and the testing that was to be done to ensure that those risks were being managed in a prudent manner. The Finance, Audit, and Resources Committee met with the auditors again on May the 25th to review the audit report and their findings. This meeting also consisted of an in-camera session where the committee members could raise any questions of the auditors without management being present. The board of directors received, reviewed, and accepted the audited statements at its June 4th, 2020 meeting. I am pleased to report that no material issues have come to light during this audit. We received a clean audit as evidenced by the auditor's full report, where it states, in our opinion, the accompanying financial statements present fairly in all material respects the financial position of the hospital as at March 31st, 2020, and its results of operations and its cash flows for the year then ended, in accordance with Canadian public sector accounting standards. During the fiscal year ending March 31st, we received a total of $537.5 million in revenue. Expenses for the year amounted to $534.7 million, resulting in an operating surplus of $2.8 million. As always, when reviewing the audited financial statements, take the time to read the notes to the financial statements. New this year is note number 21, which explains the impacts of COVID-19 pandemic on hospital operations. The audited annual statements will be posted to the Windsor Regional Hospital website subsequent to this meeting. A special thank you goes to Mark Fathers and his team for all their hard work. Mark and his team were always ready to provide any information the committee required. I would also like to thank the members of the Finance, Audit, and Resources Committee for their ongoing diligence and commitment to Windsor Regional Hospital and to our community. Thank you. Mr. Chair, I would move for the approval of the financial statements of Windsor Regional Hospital for the fiscal year ended March 31st, 2020.
Okay, so you're making that motion, and that is seconded by Arvin. Okay. Are there any comments or questions? If so, indicate by raising your hand. Seeing none, all those in favor, please indicate with the raised thumb or your hands. Okay, there's no one opposed. That motion is carried. And you have a second motion, Michael?
That's correct. Mr. Chair, I would move that KPMG be confirmed as auditors for Windsor Regional Hospital for the fiscal year 2020 and 2021.
Okay, so you're making that motion. That is seconded by Laurie. Are there any comments or questions regarding that motion? Seeing none, all those in favor? Okay, that motion is passed. Thank you, Michael. Very good report. Thank you. Okay, we are now reaching a portion of our agenda where we are going to be going through a series of standard motions that we that we process each year at our AGM. Normally, we would have the individual board members that would actually make the motion, followed by another board member who would second that. But given the fact that we are on Zoom and we have all these mutes and unmutes, I am simply going to read each of the motions and ask a board member to signify that they will make that motion, and another board member to second that motion. We will then have the opportunity for comments or questions, and then there will be a vote. At any point in time, any time during our meeting, if you want to express an opinion, or you want to have something to say, or you have a question, please indicate that electronically by raising your hand, or signaling by physically raising your hand so that I can see that. So the very first motion that we have is that we need a motion for acceptance of all acts and proceedings of the Board of Directors of Windsor Regional Hospital for fiscal year 2019-2020. And that motion is made by Pam and seconded by John. Okay. Are there any comments or questions regarding that motion? Seeing none, all those in favor? No one is opposed. That motion is carried. The second one pertains to the election and confirmation of directors and the appointment of the professional staff to the board of directors. So we need a motion that the following persons be elected to the board of directors of Windsor Regional Hospital for the first year of a 3-year term until the annual meeting of 2023. Those people being Patricia France, Michael Lavoie, and Cynthia Bissonnette. Someone making that motion? Paul, I see that, and seconded by John. Are there any comments or questions regarding that? Seeing none, all those in favor? Okay, no one is opposed. That motion is carried. Next, we have a motion that the following person be confirmed to the Board of Directors of Windsor Regional Hospital for the second year of a 3-year term until the annual meeting in 2022, and that's Dr. Lori Friedman. So making that motion, someone making that motion? Cynthia, seconded by, where are we? Genevieve? Yep, okay. Are there any comments or questions regarding that particular motion? Seeing none, all those in favor? And that also carries. In similar fashion, we need a motion that the following persons be confirmed to the Board of Directors of Windsor Regional Hospital for the 3rd year of a 3-year term until the annual meeting of 2021. Arvind Arya, Anthony Panicia, Dan Wilson, Genevieve Ishak, John Leontowitz, Pam Skillings, Penny Allen, and Paul LaChance. And making that, Lynn, okay, you're making that, and seconded by Cynthia. Okay. Are there any comments or questions? I trust that I pronounced everyone's name properly. If not, please forgive me. All those in favor? Okay, no one is opposed. That is carried. Next, we have a motion that the following persons be appointed to the Board of Directors of Windsor Regional Hospital on the authority of their positions reflected herein for the 20/21 year. So it's first David Mouche, the President and CEO, ex officio, non-voting. Dr. Anil Dar, President of the Professional Staff, ex officio, non-voting. Dr. Larry Jacobs, who's going to wear 2 hats. First as Vice President of the Professional Staff, ex officio, non-voting, and as the Associate Dean of the Schulich School of Medicine and Dentistry, ex officio, non-voting. Dr. Wasim Saad, Chief of the Professional Staff, ex officio, non-voting, and Miss Karen McCullough, the Chief Operating Officer, ex officio, non-voting. So making that motion is I need to see your hand. Okay, John, and seconded by Penny. Okay, are there any comments or questions regarding that motion? Seeing none, all those in favor? Okay, no one is opposed. That motion is carried. Next, we move to the confirmation of the committee memberships. We need a motion that the following 7 committee memberships be confirmed for 1-year appointments until the annual general meeting of 2021. Those people are, first, for the Quality of Care Committee, Nancy Gillis, Mary Dawson, Laura Copat, and Donna McGinnis, who is the nursing representative on the Quality of Care Committee. And on the Finance, Audit, and Resources Committee, Sandra Boglich, Ian McLeod, Beth Ye, and Diane Aziz. That motion is being made by Penny and seconded by Pam. Are there any comments or questions regarding that motion? Seeing none, all those in favor? Okay, no one is opposed. That motion is carried. All right, thank you for assisting as we went through that series of motions. I'd now like to take the opportunity to publicly thank and acknowledge the contribution of Lynn Watts, who is leaving the board following completion of her 2nd year as the past chair. She has served Windsor Regional Hospital for many years and will be missed as a fellow board member, a friend, and a colleague. So thank you, Lynn. Likewise, I'd like to take the time to acknowledge and thank Dr. Jocelyn Warwick for her contribution to the board while serving as president of the professional staff. She is leaving the board now following completion of her term. Jocelyn has served the board well and will also be greatly missed. Dr. Anil Dar now steps into the role as president of the professional staff. And as mentioned earlier, Dr. Larry Jacobs will serve as the new vice president of the professional staff on the board. And with that, according to the agenda, I now turn things over to Anthony. I need to unmute you.
Thanks, Dan. I'm now given the opportunity to thank Dan Wilson. There's a quote by Albert Schweitzer: "It's success is not the key to happiness. Happiness is the key to success. If you love what you're doing, you will be successful." And Dan has had 2 very successful years as board chair at Windsor Regional Hospital. I have served with him on a number of committees along the way. It's been 8 years together, Dan. Your guidance, not only to me, but to everybody at Windsor Regional Hospital, we owe you a debt of gratitude for the countless number of hours that you've put in. Your leadership through difficult times has been exemplary, and your attitude along the way is nothing short of amazing. We thank you for your service to Windsor Regional Hospital and the community as a whole. You are leaving the chair in a better spot than where you got it. No offense, Lynn. It's a building blocks. We love you, but I just want to say thank you for everything that you've done. Everyone appreciates it. So I'm looking forward to working with you for the next 2 years. With you as past chair. So looking forward to it. And I'd just like to acknowledge Michael, looking forward to working with you over the next 2 years as well as vice chair. So thank you, everybody.
Thank you, Anthony, for those very kind words. Much appreciated. And I do want to thank everybody. I mean, it is, as we've said before, it's a team effort. I mean, whatever has been accomplished, we've done it together. And it's been an honor and a privilege to serve in this capacity. And while we're here, Anthony is going to be assuming the role of chair going forward. And he and I have already served many years together. And Anthony has served in several leadership capacities on the board, and he brings some very strong skills and some great abilities to his role on the board. And I know that he is going to do an excellent job. So good luck to you, Anthony. We're all here to help you. So with that, if there's nothing else from anyone, I don't see any hands. Okay. I now need a motion to adjourn the 26th Annual General Meeting of Windsor Regional Hospital. Someone willing to make that? Lynn, okay. You're doing that, seconded by Paul. I'm assuming no one's opposed, but I'll give you the opportunity. Otherwise, okay, that motion is passed. And now this concludes the 26th Annual General Meeting of Windsor Regional Hospital. And now the new board chair, Mr. Anthony Panicia, will convene a short meeting for the purpose of processing certain motions that are required prior to us breaking for the summer. So with that, Anthony, I will turn it over to you, Mr. Chair. Hang on a sec, Anthony. Got to get you unmuted here. Hang on a sec, Anthony. There we
See,
go.
I'm already screwing things up, Dan. Big shoes to fill. So I'd like to call this meeting to order. Are there any declarations of conflict of interest? See none. We're going to move on to new business, and much like Dan, for the sake of speed and Zoom, I will read the motions and then I will ask for a mover and a seconder, so bear with me. The first motion will be the following slate of officers be appointed for 2021. Chair, Anthony Panicia. Vice Chair, Michael Lavoie. Treasurer, Penny Allen. Secretary, David Mouche. Past Chair, Dan Wilson. President and CEO, David Mouche. Can I get a motion? Sorry.
Lori.
Oh, sorry, Lori. Thanks. And a seconder is John Leontowitz. Thank you. Questions or comments with regards to that? Seeing none, all in favor? Unanimous, thank you. Moving on to the second is the Executive Committee of the Board of Directors be empowered to transact business for and on behalf of the Corporation of Windsor Regional Hospital for the months of June after the 25th, July and August 2020, provided that the Executive Committee, in exercising of its authority conferred by this resolution, shall keep the board informed by providing minutes of meetings of the Executive Committee to the board, and where matters of significant importance in relation to the hospital arise, the Executive Committee shall call a special meeting of the board as may be required to deal with said matters. Can I get a motion? That's Arvind, and seconded by Cynthia Bissonette. Thank you, Cynthia. Questions or comments with regards to that motion? Seeing none, all in favor? Unanimous. Thank you. And lastly, the Executive Committee of the Board of Directors be empowered to approve any and all non-competitive procurement, non-application, and limited tendering provisions in accordance with the hospital's procurement policy and procedures for the months of June after the 25th, July, and August 2020, provided that the Executive Committee, in the exercising of its authority conferred by this resolution, shall keep the board informed by providing a summary of those signed documents at the September 3rd, 2020 board meeting. Can I get a motion? So that's Genevieve Eshok, seconded by Sorry. Oh, there's Penny Allen. Thank you, Penny. Any questions or comments with regards to that resolution? Seeing none, all in favor? And opposed? Motion carries. Thank you so much. Can I get a motion to adjourn? Oh, Dan Wilson. Thank you. And seconded by John Leontowitz. All right, that concludes this meeting. Our next scheduled meeting, open board meeting, will be September the 3rd. It's a Thursday night. Thank you again, everybody, and we will see you all very soon.